Hey, good morning, guys. This is Dr. Derry here, owner of Revision Health Services down here in Jacksonville, Florida. And I wanted to go over this video today. It's actually with a real patient. I often get the question of what's the best core exercises for those with low back pain. I see a lot of stuff out there regarding core exercises, but they always show somebody who's not in pain and in really good shape and not really dealing with some low back pain. So I wanted to go through this video today of some initial strengthening I do with those with low back pain that's been shown to be safe, effective for the long term, and go over some instruction how to do it. So as you're going to be able to tell in this video, you'll see me with the client here, and they're going to start laying on their back. Now, obviously, not everybody has this table, but you can do this on the floor as well. So you're going to see me kind of help him recognize where certain body parts are, his pelvis. I'm putting my hands on his pelvis so I can help him engage his abdominals, what's called the transverse abdominis. And so don't mind me looking up there. I'm always trying to check the camera angle there. So he's feeling down, and I'm giving him some cues to help engage. And so the big one here is to kind of flatten your back to the floor. There's this natural little curvature in your low back when you lay down, so you want to reduce that, flatten it to the floor. Then also place your hand on the side of your hips, and you're going to feel your hip bone, but then kind of come up towards your belly button where it starts to feel soft. Then you're going to feel a little drop off, and I'm having him suck his belly button down towards the table. And if you look close enough, you can see it. Basically, you're going to act like someone's trying to punch you in the gut, and you're going to draw in your belly button. So this is an engagement of your transverse abdominis. I like to call it the corset of your spine, and it basically wraps around from your abdominals, the six-pack abs, and all the way down, all the way around to your lower back. And so it's always one that I like to learn to engage, just so we can be aware of our abdominals and get some gentle strengthening in without a ton of movement. So strengthening your abs isn't doing crunches, it's learning how to engage and then progressing as you start to feel better. And so we know that our core's responsibility is to absorb force and help us with movement. And so that's exactly what we're learning here in this video, is how to engage it, so we can move better and it can absorb some of those forces of our everyday life that our spine necessarily can't handle right now or is a little irritable. So you're going to see me adjust the foot here. So we're going to move on to the second exercise, which where we're looking at the transverse abdominis contraction, that first belly button draw in maneuver you see there. And then you're going to see him lift his leg while trying to hold that contraction. And then this is leveling up. This is level 2 here, and this is tough. I've had my athletes do this, and they have a hard time engaging here as well. So his range is also limited based on how well he can hold it. So he's going to draw in his belly button, try not to hold his breath at the exact same time lifting the leg up. And so he is a younger male, and you can see that he's struggling with that himself. So don't be surprised if it's hard at first, but you can get it. Don't give up. It is good for you. And so he's going to move in through that, and you can see that it's slow and controlled. That's the key. So you're going to see that leg go up and down. Faster is not better. More is not better. It is learning how to engage. So I always tell people it's more about how you do something versus what you do. And so we're going to move on to the last one here. So I just had him move him arm out of the way there so you can kind of see what's going on there at the spine. So the third and final one here, and what I love about all these is you can do them all in a row, but you're gonna have to engage that transverse abdominis. So you can see his far hand, the left hand is feeling engagement, and then he is digging his heels into the table and lifting his butt up. And this is my fault in this video. His heels should be level with one another, but they're not. But that's okay. There's some variation, and you're going to see me kneel down so I can get a better angle about what's going on here. So, and you can, I want you to appreciate his height that he's lifting to there. So you can tell that he's not lifting very high, and that's because it is a little uncomfortable. So you want to move into the discomfort. I always tell people you want to flirt with it a little bit. Don't go past it. Don't go past any limits there, but flirt with that line of, I know it's good for me, it's working something, but I also don't want it to flare me up or cause me discomfort. And so I have found that these exercises are really, really beneficial for those dealing with maybe some newer pain, maybe some older pain, wanting to engage their core, wanting to improve their strength, and don't know where to start. This is a great place to start. And I would tell you that if you go into most clinics, you're going to see therapists do this with you. And so I would say challenge yourself, do this exercise, see how it goes, refer to the video, and if you guys ever have any questions, feel free to reach out. Again, this is Dr. Derry, Revision Health Services down here in Jacksonville, Florida, and stay moving and take care of yourself.